Hello everyone. In this video, we will learn about the CRP test. That stands for C-Reactive Protein test. It's a simple blood test with powerful diagnostic value. So let's start the video and understand it together. So what is the CRP test used for? It is used to monitor the inflammatory status of our body. It helps doctor to find out if there is any inflammation inside our body and how severe it is. So why does inflammation happen in the body? This inflammation can occur due to many reasons, such as bacterial infections, viral infections, autoimmune diseases, tissue injury, chronic diseases, and many more. So do you know what CRP test actually measure? Yes, it measures the level of C-reactive protein, which is actually a pentameric protein composed of 5 identical subunits arranged in a ring-like structure. And do you know how this protein got its name? Well, when scientists were working with the blood plasma of a patient with pneumonia caused by Streptococcus pneumoniae, they found a unique protein. And this protein reacted with a specific part called the C polysaccharide present on the bacterial capsule. And because of this reaction, they named it C-reactive protein. Now, the most interesting thing is our liver is responsible for forming these CRP protein in our body whenever any inflammation or infection occurs. But here's the question. How does the liver even know that our bodies is struggling with inflammation? How does it get the signal? Well, here's come the mechanism. So, whenever there is a tissue damage or any pathogens enter in our body, our immune system get activated and certain immune cells like macrophages, WBC, adipocytes, they get activated and they release special chemical messengers called cytokines, especially interleukin 6. And these cytokines travel through the blood and reach the liver, and they give the signal to the liver. And once the liver receives this message, it gets activated and start producing C-reactive protein as a response. Now the CRP protein enters the bloodstream and their level rises significantly during inflammation. And that is what we detect in the CRP test. So far, we have understood that liver is responsible for producing CRP. Now, what happens after CRP is formed in our body? These CRP proteins have both pro-inflammatory and anti-inflammatory properties. They play an important role in identifying and removing harmful microbes and damaged body cells. But to perform this function, CRP needs to bind to specific receptors. And these receptors are phosphocholine and phospholipids, which are actually found on the outer surface of many bacteria, especially Streptococcus pneumoniae. And as well as they are also found on our damaged or dying cells. So by binding to these phosphocholine receptors, CRP helps the immune system to recognize and eliminate these harmful microbes. Now, once the CRP binds to the bacterial cell wall where phosphocholine is present, this binding activates a complement protein called C1q. Now, this C1q activates other complement proteins and they together form a complex called the membrane attack complex. And this membrane attack complex sticks to the surface of the bacteria and kill the bacteria by making holes in the cell wall. So in this way, CRP helps in killing bacteria through the complement system. Now the second way is called phagocytic activation. In this method, CRP can directly act as an opsonin by binding to the surface of bacteria, or it can take the help of the complement system. CRP once bind to the bacteria activates C1q, which trigger the classical complement pathway and leading to the formation of C4b and C3b. These two complement proteins act as a strong opsonin. which means now the microphages or WBC recognize these opsonin tagged bacteria through their receptors, and now these macrophages bind to the bacteria, engulf them, and destroy them. Now let's discuss a few common questions related to the CRP test. The first question, what happens during a CRP test? So it is just a simple blood test. A healthcare professional will collect a blood sample from the vein using a small needle. Second question, do we really need any special preparation before this test? So the answer is no special preparation is required. However, some medications may affect the test result. So make sure to inform your doctors about your supplements or medicines you are taking, especially non-steroidal anti-inflammatory drugs or aspirin. And third question, is there any risk with this test? So there is no major risk at all. Next question, do we need to fast before this test? So the answer is fasting is not required, but doctor may recommend fasting, especially if the test is done along with some lipid profile test or cholesterol. Let's now talk about the most important part, interpreting the CRP test results. First, we should remember this C-reactive protein is normally present in our body in a very low amount. A higher level than normal usually indicates that there is some inflammation going on in the body. But here's one thing to remember, this CRP test does not tell us the exact cause or location of this inflammation. That means this CRP level alone is not enough to diagnose a disease. To find out the exact cause, your doctor will also look at the symptoms, other test results like CBC or ESR, and other medical history. Let's now talk about the normal range for CRP, which can slightly vary depending on the lab's testing method. For example, some labs consider zero point 0.3 to 1.0 milligram per deciliter as normal, while other 0.9 to 3.0 milligram per deciliter. So if your CRP level is above the upper limit of the lab reference range, it usually means there is some inflammation in the body. Now let's understand the conditions in which CRP is elevated. Let's quickly look at the key ones. Number one, inflammation. CRP increases in any kind of inflammation, whether it is due to injury, surgery, or chronic diseases. Second, pregnancy. Mild CRP rises normal, but a high level may indicate infection or complications. Number three, autoimmune diseases. Conditions like rheumatoid arthritis or lupus cause ongoing inflammation, raising CRP levels. Number four, bacterial infection. CRP shoots up sharply, often above 100 mg per liter in serious bacterial infections like pneumonia or sepsis. Viral infection, CRP also rises in viral infections like COVID-19, but usually not as high as bacterial ones. And the most important, heart diseases. Even a slight increases in CRP can mean a higher risk of heart attack or strokes. CRP has a prognostic value. An increased CRP level indicates more cardiovascular risk. Here are the high sensitivity CRP levels and the interpretations. Less than 1 mg per liter indicates low risk, between 1 and 3 indicates intermediate risk, and more than 3 indicates high risk. However, high CRP level must always be correlated with medical history, physical examination, other cardiovascular risk factor, and lab results. Okay, that's all for today's video. If you found this video helpful, please don't forget to hit the like button, share, and subscribe to my channel. Thanks for watching. See you in the next video.